Okay, good afternoon, everybody, and welcome to the City of Toronto's COVID-19 media briefing for Tuesday, April 21st, 2020. Before we begin, Dr. de Villa will have a 4-slide presentation for those who are online and watching from wherever you may be. You can download the presentation at toronto.ca/COVID-19. There are 4 slides there. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Well, good afternoon. Thank you, Brad. Today I convened a meeting by video of the mayors and regional chairs of the Greater Toronto and Hamilton area. I want to thank all the mayors and chairs for taking the time to meet so that we can discuss the impacts of COVID-19 on the region and how our municipalities can work together on seeing our very real financial challenges addressed, and also addressing the important matter of economic restart and recovery. We are united in fighting COVID-19, protecting our residents, and saving lives. While the measures we have taken to stop the spread of the virus have made a difference, the virus has still taken far too many lives in our communities and continues to threaten the lives of our residents. This is a global human tragedy, but it is also a tragedy for so many families here in Toronto and across the GTHA. Our condolences are with all of those who have lost loved ones to this terrible virus, and I'm sure I extend those on behalf of all of my colleagues who met today. At the same time, there is no denying the devastating impact of COVID-19 on the economy. Jobs have been lost, many businesses have closed or are at risk of closure, and many families are worried about their financial future. We've been hit hard, and so have our residents and businesses. But that's why it's so important that we keep moving forward and come back as soon as possible and as strong as possible. We know that the Toronto Centrist metropolitan area alone is projected to lose some 355,000 jobs and 28% of GDP, along with $894 million in revenue and lost wages, $3.7 billion in revenue losses for businesses. This will be felt right across the GTHA, but it also threatens the provincial and the national economies. A strong recovery right here in the GTHA is crucial to healing the economic damage done by COVID-19 and helping the families and businesses all governments have been working to protect throughout this emergency. Ontario's economy and Canada's economy need the GTHA to come back stronger than ever when the restart begins. We are determined to deliver this recovery. As mayors, we agreed today that we are determined to deliver the recovery and that the GTHA municipalities will be working together to successfully and smoothly reopen our vital regional economy when the time comes. I should say, however, that the mayors and chairs were very much of the view that the time has not yet come and that we need to bear down on the advice of our respective medical officers of health to beat this virus back. There is work yet to be done. We also discussed how we can, in a consistent way, achieve significant necessary financial support from the other governments to help us to mitigate the impact of COVID-19 and protect our ability to contribute to the recovery. We've agreed that we will work together to share information about our respective financial positions and explore together measures we can advocate to the other governments, which will help to ensure the financial stability of local and regional governments in the Greater Toronto and Hamilton area. A strong recovery needs strong cities and strong regions. Our regional economy is very integrated, and so this opportunity to work together and to stand together will hopefully produce a better overall result. Our child care and recreation programs across this region help parents get back to work. Our emergency services keep people safe. Our transit systems get people to work and home again safely. Our major infrastructure projects, often built in conjunction with the other governments, help kickstart the recovery. They will do that, and they will help create a lot of jobs at the same time. Our economic development activities attract new investment and create new jobs. We built a strong and vibrant Greater Toronto and Hamilton area, and we know that we will need to come back even stronger and as quickly as we can when the time comes in order to keep Canada's economy going. With the cooperation and support of the provincial and federal governments, we are ready to rise to this challenge. Now, throughout this emergency, the City of Toronto has been committed to ensuring that our frontline staff, who are doing such a fabulous job for us day in and day out, including emergency responders, those working with individuals who are experiencing homelessness, and staff in long-term care homes, that all of those people have the personal protective equipment needed to stay safe and to protect their health and the health of the community. Today, I'm proud to announce that, again, through the hard work of a lot of people on our team, the City of Toronto has received 3 million ATSM Level 2 surgical masks. These masks, ordered from Canadian distributor A.M.G. Medical Inc. in late March, arrived in 2 shipments, with the final shipment of 2 million masks delivered to the city earlier today. The new masks have been carefully examined, and staff have confirmed that those masks are as ordered and have passed inspection. Surgical masks are used extensively by staff in the city's emergency shelter system and in long-term care facilities. This is good news for the city's PPE supply, and we've asked Chief Pegg to give a full update on the current situation so the public has the same information about our supply of this vital equipment as we have at the Strategic Command table. The city is continuing to source PPE to support frontline workers responding to COVID-19. That work is nonstop, and I thank all of the city staff and all of those involved in helping to make sure this supply line is maintained intact. I've also made it clear in our meetings that I want to make sure that we're taking steps now to build up the supply of PPE beyond this pandemic so that we are even better prepared for any future waves or, heaven forbid, another pandemic. I also want to recognize the work that Toronto Paramedic Services and the TTC have done together at what I call wartime speed to convert 5 decommissioned TTC buses into patient transport vehicles. These vehicles have been outfitted to safely transport both ambulatory and stretcher-bound patients, including those on ventilators. Each bus can transport 3 stretcher-bound patients, 8 to 10 ambulatory patients, dependent upon spacing for physical distancing reasons, plus 3 paramedics and 1 driver. The buses, 3 of which were converted in 1 week, will give paramedic services important surge capacity, if required, during the ongoing pandemic. And those buses, of course, will now also be available to help when needed in the future. Again, an example of wartime speed. So I want to say thank you to Paramedic Service Chief Gordon McKeegan and TTC CEO Rick Leary and your teams for your work on this project. It is this type of cooperation between city organizations that we're seeing in so many areas day after day after day, and it is contributing to helping our city respond to this emergency health situation and protect our residents. As we continue to hear from Dr. de Villa, the COVID-19 fight is not over. We need to keep working to ensure all people in this city are protected from this deadly virus. Based on the province's original projections, we have saved, you have saved, thousands of lives thanks to all the efforts that millions of people have undertaken, collectively and individually. Now we have to make sure we finish this fight, defeat the virus while also preparing for a careful restart. I know people want a date. I get asked, my most frequently asked question these days is, when is that date? I don't have one. I want one of those dates too. But right now we don't have a date. I can tell you 2 things. The exact date on which we start to move into recovering our economy and reopening the city will be based on the professional public health advice that has helped guide us through this pandemic so far. The same advice that has saved lives and that has kept so many people from getting sick. We won't subject people to these life-saving restrictions as one moment longer than needed to protect their health and the health of the city. But I will stress once again, that determination will not be based on politics, it will not be based on weather, or it will not be based on levels of easily understood frustration that people are experiencing now, but rather it will be based on science and the very best public health advice that we followed since day one. And on that note, I will ask Dr. de Villa to make her presentation for today.
Thank you, Mayor Tory, and good afternoon, everyone. As of 12:30 this afternoon, there are 3,000 820 cases of COVID-19 in Toronto. This includes 3,462 confirmed cases and 358 probable cases. There are 281 cases that have been hospitalized, 109 in intensive care units. I'm sad to report that we continue to see deaths in our community, and in total, 190 people have died from COVID-19 in Toronto. On behalf of my entire team, I offer sincerest condolences to everyone who has lost loved ones to COVID-19. Today, I'm providing you with a further update on our local COVID-19 data. Referring now to the slides that Brad mentioned at the beginning, you'll see that the first slide shows that the trajectory for cases of COVID-19 is lower for Toronto, Ontario, and Canada than other places such as Spain and the United States. These countries have unfortunately seen a large number of cases since their COVID-19 outbreaks began. We believe at this point that the number of cases to date in Canada, Ontario, and locally in Toronto is lower than originally forecasted, due in part to the strong public health measures that were put in place early in our outbreak and the fact that our residents took these measures seriously. Thank you, everyone, for following the advice to stay home and to practice physical distancing. I know it has been difficult, but I hope you are now seeing the benefits of these actions. The second slide shows us the actual number of cases we have experienced in Toronto over time. Specifically, it shows that we believe we are now in the peak period of the epidemiological curve of our community outbreak. I use the term peak period because the peak is not really just one day, nor is it really just a single number, as the number of cases on any given day during this peak period will vary. The reality is that we will only know when we have hit our peak for COVID-19 cases after the peak has passed. This is because we need to see the number of new cases leveling and then going down to know that we have experienced this milestone and we can see exactly what has occurred. Managing outbreaks is part of our core work in public health. We do analyses to make predictions to inform our public health actions. We monitor what is occurring to adjust our actions as needed. It is only at the very end of an outbreak that we can know fully exactly what happened. This occurs once we have all of the confirmed facts and numbers. In this instance, as it relates to slide 2, as we move down the curve, the timeline of the outbreak may be shorter or longer. This depends in part on our ability as a community to remain diligent in following the public health and physical distancing measures we have put in place. Slide 3 illustrates how we can now look back to understand what has occurred in our city thus far. This slide shows the number of hospitalizations, ICU admissions, and deaths to date. This information helps us understand how we have used our healthcare system resources during this outbreak. As I shared with you yesterday, the information on slide 3 should be considered with cautious optimism. It illustrates that we are seeing our curve flattening. The slide also illustrates the impacts of our collective work to prevent overburdening of our healthcare system and to ensure that critical health resources remain in place for those who need them most. This is an important indicator for us to continue to monitor as we move down the curve. It will help us to plan and know when we can begin to ease some of our local public health and physical distancing measures. It is critical that we ensure that we have healthcare resources and capacity in place to manage outbreaks we are seeing amongst vulnerable groups, including our long-term care homes and our shelter settings. The city is looking to support the 10 long-term care homes it operates through the redeployment of some members of my team at Toronto Public Health, particularly registered nurses and registered practical nurses, whose unique skills are needed to provide care to some of our city's most vulnerable residents. We also need to ensure that our health system remains strong to help to continue to manage this outbreak through the second wave. We know that we will likely experience another COVID-19 wave because we have yet to reach a high level of immunity in our community. We will continue to see COVID-19 spreading in our community until we start to experience herd immunity. This will not happen until many people are infected with COVID-19 and recover, and they build immunity that lasts, or we develop a vaccine. We know that treatments and a vaccine for COVID-19 are several months, if not more than a year away. This is why we continue to ask everyone to stay home and practice physical distancing so that the rate of infection in our community does not overburden our local health system. The final slide tells the tale of the 2 outbreaks we are experiencing. We know from our data that we have an outbreak within the general community, which we believe is peaking. A key point on this slide is the information on the cases in institutions. Of note, we see that females represent approximately 60% of our cases in long-term care homes, retirement homes, chronic care, and hospital settings. We believe that this is because, on average, females tend to live longer than males and therefore comprise a significant proportion of people in these settings. In addition, knowing that these data also reflect cases amongst staff, we know that women are more likely to be employed in professions in these settings. Taken all together, these slides summarize some of the main types of data we are analyzing at this time. In addition, I am pleased to announce that starting today, a data dashboard with data that depicts the 2 COVID-19 outbreaks we are experiencing, community and institutional, will be available on our website. The dashboard will be updated frequently so that you can track in real time how the outbreaks are evolving in our community. Finally, I've been asked to provide updates about the situation in specific long-term care homes and shelters. At Eatonville Care Center, there are approximately 130 COVID-19 cases at this home, which is an increase of 16 cases since yesterday. Tragically, there have been 30 deaths recorded at this home and formally accounted for in our reporting system. Lastly, at the Willowdale Welcome Center, there are approximately 110 positive COVID-19 cases in this setting, associated with the testing efforts undertaken at this site. These data are premised on verbal reports that I received today. The large number of cases reported in these settings is due to an approach that has been taken within these facilities where all residents and staff have been tested to ensure that there is a good understanding of the status of their outbreaks. This approach also allows for thorough follow-up to occur and for the situations to be as well managed as possible going forward. This concludes my remarks for today. In the meantime, please remember that the most important thing you can do is to continue to stay home, stay safe, and take care of each other. I'll now turn it over to Chief Pegg.
Thank you, Dr. de Villa, and good afternoon. Since we began planning for the outbreak of COVID-19, which commenced before the first case had been reported in Canada, the issue of personal protective equipment has been at the forefront. Our EOC incident management structure includes a dedicated PPE task force. This task force is responsible for managing the city's PPE, projecting PPE needs, implementing PPE conservation strategies, as well as investigating alternative PPE options and procurement strategies. The women and men who have been tasked with securing and managing PPE for the city embrace their critical role in ensuring our frontline essential and critical service workers have access to the PPE that they need to be able to do their jobs safely while they work to keep our communities safe. As Mayor Tory announced earlier today, we have now taken delivery of 3 million Level 2 surgical masks. These masks have been fully evaluated and inspected by our staff, who have confirmed that they meet the specifications and are ready to be placed into inventory. Surgical masks are used extensively in the city's emergency shelters and in our long-term care facilities. This new influx of PPE will ensure that our staff continue to have access to the PPE that they require as they help our most vulnerable residents in our shelters and in our long-term care homes. Our current PPE inventory levels are as follows. N95 respirators. We have approximately 101 days of inventory at today's consumption rate and 31 days inventory under worst-case scenario consumption rates. Surgical masks. With the latest order being received, we now have approximately 182 days of inventory at today's consumption rate and 87 days at worst-case scenario. Isolation gowns, we have approximately 56 days of inventory at today's consumption rate and 20 days at worst-case scenario consumption rate. And face shields, we have approximately 25 days inventory at today's rate and 7 days at worst-case scenario. The city is continuing to source and manage PPE in support of our continuing response to COVID-19. Following unprecedented water levels in Lake Ontario in both 2017 and 2019, our Office of Emergency Management is working in collaboration with a number of partner divisions and agencies in advance of the 2020 flood season. These partners include the Toronto and Region Conservation Authority, the city's Parks, Forestry and Recreation Team, Strategic Communications, Toronto Fire, Police and Paramedic Services, and Toronto Water. I'm pleased to advise that the authorities are forecasting lower Lake Ontario water levels this year than those experienced in both 2017 and 2019. Nevertheless, our OEM flood planning team continues to both monitor the situation and to proactively plan and prepare for any unexpected rises in Lake Ontario water levels should that occur. Lake Ontario water levels are continuously monitored by TRCA. As of this morning, the Lake Ontario water level was stable at 75.39 meters. By way of comparison, the water levels peaked at 75.93 meters in 2017 and 75.95 meters in 2019. Formal Lake Ontario water level triggers have been established on a proactive basis, and escalation plans are now in place. Should water levels rise above the predetermined trigger level of 75.5 meters, our teams will be immediately convened in order to assess potential impacts and to implement flood mitigation plans as required before water levels reach dangerous levels. We are continuing work on a number of flood and erosion hazard mitigation projects that will enhance the protection of both public safety and municipal infrastructure from floods. These projects include works on the Toronto Islands, as well as at Bluffers Park along the Lake Ontario shoreline. These proactive flood mitigation and response plans are examples of the important work that is being coordinated within our Emergency Operations Centre concurrently with the COVID-19 planning and response effort. As a city, we continue to provide the essential and critical services that our residents both need and rely on each and every day in Toronto. I'm proud of every member of our City Toronto team who continues to work hard in support of our residents each day. Thank you.
Thank you, Chief. Before we go to questions, just to let reporters know that both Marianne Bedard and Paul Raftis are on the line should you have questions for them. First question is to Camille Karamali from Global News. Camille?
Thanks so much. This is a question for Mayor Tory. You had mentioned briefly, and I know you said it time and time again, that we're nowhere near reopening anything, but the planning should start, or at least thinking about it should start beginning now. Can you give me an example or a few examples of some things that would start opening first before others, and other things that would sort of be lower priority on the list? I think you'd mentioned dog parks over sports fields, for example.
I wish I could do that, but you know, one of the things we've learned in our early discussions about this with some of the people, including the public health experts, is that the last thing you should do is to start to speculate on what will be first and what will be second and what will be third and how fast it happens and all of those different things. That's why we're going about this so carefully. We spent a good chunk of time on Saturday sitting with the initial group of senior people that are going to try and get the resources in place from our public service and elsewhere to make those decisions. And I know there's a lot of people out there. I hear from people involved with community gardens, golf courses, sports fields, hair salons. They all call me and email me and approach me, and you know, even around here. And the bottom line is we're going to do it carefully, we're going to do it methodically, but we're going to do it most of all safely based on public health advice. And we will come forward with a plan in an integrated manner that has a phase one, that will have somebody who goes first, but that will be based on thoughtful consideration, not based on you know, petitions or things like that. We have to do these things based on science.
But has any of the, I guess, urban planning begun? We've heard from experts who say potentially expanding bike lanes or you know, to ease traffic off the streets and into bike lanes. Has any of that planning in terms of what the urban infrastructure would look like in that, you know, slow and gradual reopening period, has pen to paper happened at all on that front?
But the point you make is an excellent one. That's precisely why what you're going to hear from us in due course from the city is an integrated plan that takes into account all the different aspects, which include what businesses, what enterprises, what institutions, educational and otherwise, are opening and when, and how will they open, and what will be involved potentially in terms of things like testing. All of those things being based on public health considerations, but what then accompanies that is a whole series of other questions. How does the TTC react to that in terms of providing service on a non-crowded basis? How do you deal with other kinds of transportation and mobility? So that's why you're going to get an integrated plan and not little bite-sized pieces that may well please people that are in groups that care about these kinds of things, but it's just not the right way to go about this. It's going to be an integrated, complete plan. The work has begun, but it's a lot of work. It's very complicated. There's not a place in the world that's ahead of us on this work that has found it easy or simple to do, and Toronto will be no exception, but we're at work on it now.
Okay, thank you. We'll go to Chanel Call from CP24. Chanel?
Hi there. I'm hoping that my audio is working. I just got bumped off and I think I'm back on.
You're on. Go ahead.
Mayor, okay, perfect. Mayor, I'm just wondering, I think this may have been asked, but just wondering about that meeting that you had last weekend, and given some of the optimistic provincial modeling that we saw yesterday, do you think things are going to move any quicker?
I don't think so, but you see, we base our plans. Yeah, we're obviously hoping to do all of this on an integrated and cooperative and collaborative basis with the province and with the federal government, for that matter. But we also have our own set of considerations. Toronto is a different place. Even the mayors that I met with today from all the cities around Toronto felt that we had a lot of work to do collectively to get to a place where we could reopen. One of the worst things we could do, and I don't want to put words in their mouths, but I think they pretty well all said this, that one of the worst things we could do is to rush it, either because you feel political pressure or because of the levels of frustration, which I understand completely, or because the weather's going to get better, all of which are realities. But I think what we're going to have in our own case is what we conclude is the best plan for our city based on the advice of our medical officer of health, obviously in collaboration with the Government of Ontario. On Saturday, we began to take the first steps in doing that planning, but it's extensive, complex planning, and therefore it won't be done quickly. And that will coincide with what was said at the beginning by our medical officer of health to be a 12-week projected schedule to get us to a stage where we might be able to look at implementing some of these plans. And that 12 weeks still has, several weeks to go, quite a few weeks to go, and it's very much dependent on the kinds of numbers that Dr. de Villa talked about today and the kinds of improvements she said were necessary before we could implement a plan like that to reopen the city.
And just a follow-up question, Mayor, just wondering whether you could provide us some clarity on what's going on with landscaping services in the city. It looks like some people are working, some people aren't, especially with all this spring weather coming up right around the corner. Is this service allowed?
It's very frustrating for me, I'll say, because I'm hearing a lot about this from councillors, from residents of the city, and so on. And if you look at the provincial order, what it says is something of the nature of landscaping work that is pertinent to or a part of larger kinds of construction projects. So it doesn't really seem to contemplate people having their lawns cut. But at the same time, I understand there are a lot of seniors who rely on these landscaping companies to look after their properties because they're not able to do it themselves. So it's frustrating, but I will say that these are some areas where you might get some kind of a clarification from the province in light of some of these complexities that kind of make it a gray area, and that it is part of their order, not a city order, and so anything that would happen to provide a different set of circumstances would have to be by agreement of the provincial government as opposed to the municipal authorities.
Okay, thank you. We'll go now to Janice Golding from CTV. Janice, go ahead.
Hi, I was just going to ask, we keep seeing the cases and death tolls continue to rise at the long-term care and retirement homes. You mentioned Dr. de Villa, Edenville, and Willowdale. We also saw that there were 29 deaths at Seven Oaks at this point. And the numbers are rising both among staff and residents. What do you have to say about that? I mean, how concerned are you? What are you doing? What can you do to deal with the situation?
So thanks for the question, Janice. I think you've heard me say on a number of occasions that we are indeed concerned about that which is happening within our long-term care homes. And we have been concerned from the outset because we heard from other jurisdictions who were ahead of us in the outbreak in their COVID-19 experiences that COVID-19 had particularly severe impacts on older populations. And we know that long-term care homes are home to many of our older members of our community, many of whom have chronic health conditions or immune compromise, as part of their medical picture. So we've always been concerned about that. I would say, as I've said over several days now, that we should expect to see increases in the cases in these settings because we know that there is more of a concerted effort thanks to that which our provincial government has done. They are responsible for testing and they have called for more testing and set up the circumstances such that there is more testing happening within these settings. Now, that gives rise to a higher number of cases, certainly, but it is a good thing because it helps those settings, those staff within those homes to be able to direct resources appropriately to ensure that they're taking every action that they need to take in order to protect their staff and residents, and they can monitor their progress. And in fact, when we have seen homes understand what their circumstances are, and when they implement those stringent outbreak control measures in a very consistent fashion, we do see the positive effects of that. So that's why I think it's important that we continue to support the testing initiatives that have been started by our provincial counterparts.
The numbers, though, are very alarming. So I'm just wondering, is there anything else that you could possibly be doing to protect both the staff and the residents at these centers?
Well, I think that what we've seen as of late is a more concerted effort between the various partners, and that would include our acute care partners. There have been folks from the LINs, the Local Health Integration Networks, members of the Ontario Health Team, acute care partners who have started to see, some leveling off in terms of the demands on their services. So they're lending support along with local public health units. And this is not a unique story to Toronto. This is something we're seeing across the province, and indeed we've seen it in other jurisdictions as well. But in our local circumstances, we're seeing more and more collaboration across the entire health system to support the needs in long-term care so that we can help bring that situation under control.
Okay, thank you. We'll go to Brian Passafian from the Toronto Sun. Brian, go ahead.
Good afternoon. Many questions for the mayor. As you know, the outbreak's having a pretty heavy toll on the city's restaurant industry. You mentioned earlier today that you've been speaking with food delivery companies to relax some of the high commissions they charge to eateries. Is that something you'd consider including in some sort of a future emergency order?
The fact is that I already investigated doing something similar to what they've done, for example, in San Francisco, where they mandated a commission of 15% during the emergency, and I don't have the power or the authority to do that. If I did have that power or authority, I likely would, because I think it is so much in the interest of protecting a vital industry that represents thousands of jobs for the city. And so I put the challenge out now, since I don't have the legislative power to do that, to the delivery industry. There are a couple of companies there that have taken slightly better steps to reduce these very high levels of commission, which run at the sort of 30% range. So that 30% is coming off the top. When you order something to have them deliver it to your house, they're taking 30% off the top out of the pocket of the restaurant people who are just trying to make these meals to try and keep things together. And so I would challenge somebody to come out and show some leadership. I've talked to some of the companies, and they didn't seem to take me up on that when I asked them if there was anything they could do. I think it's up to one of those companies to do what Loblaws did when it came to, putting health workers at the front of the lineup in the grocery stores. Somebody in the food delivery lineup can use the marketplace to say, we're going to show some leadership here. We're going to step up and help these restaurants for the emergency period. That's all it is. It's a couple of months, or a period of time like that. And I think it will do a huge amount to boost confidence and to do the kind of thing we do, which is we help each other.
That's all I got. Thank you.
Okay, Brian, thank you. We'll go now to Jennifer Pagliaro at the Toronto Star. Go ahead, Jen.
Wondering if Marianne could provide an update as to the city's progress in increasing distancing in shelters.
Sure. Marianne?
Hello, Jennifer. How are you? So yes, we've been making continued progress with our plan to create physical distancing in the shelter system. We are more than 1,200 people have been moved in the last few weeks to create physical distancing. We also continue to work on our rapid rehousing program, making sure that people are moving into permanent housing as part of the response. And we also continue to call on the provincial government to work with us, to help us prioritize proactive testing, to work with us on a regional recovery response, and to make sure that we are responding appropriately to the needs of this vulnerable community.
There was a letter sent from a coalition that is threatening legal action against the city, saying that there are charter violations, human rights code violations. I wonder how the city responds to that and what other measures can be put in place in order to do what these groups are asking.
Well, I mean, first of all, I'd like to acknowledge the urgency that they talked about in their letter is absolutely something that we share. It has been at the heart of the swift response that we have implemented in the City of Toronto. In every decision that we have made, our sole goal has been to save lives and to make sure the healthcare system doesn't become overwhelmed. And we focused our response on a number of tiers to make sure that we were doing the appropriate things at the appropriate time. Initially we focused on prevention, working with public health to make sure that our operators knew the appropriate guidance and training and providing tools around physical distancing and infection prevention control. We provided funding for agencies to help them secure PPE and enhance their staff wages. And as I said, we've worked closely with our community organizations as well to create almost 1,300 spaces for physical distancing, and we will continue to do that until we reach our goal of 2,000 by the end of the month. And, you know, it was only a matter of time before the pandemic did enter into the shelter system, despite our best efforts, and we've continued to take significant steps to make sure we're mitigating the impact. We had Canada's first isolation program for people who are waiting for test results. We've secured a recovery program for people who have tested positive, and this is a significant relief to the provincial healthcare system so that they can actually receive the care that they need and not burden the healthcare system during their illness. So I think, you know, there are lots of frustrations, and I recognize that people will always feel like more should be done, but I can assure the public that everything that can be done is being done, and we take this responsibility very seriously.
Thank you, Marianne. The next question is to Matt Bingley from Global News. Matt?
I'd just like to follow up on what Jennifer was asking about. Was just wondering if Mayor Tory could actually respond to the fact that there is a group seeking an injunction against the city to compel it to do more, saying repeatedly that the city is not doing enough for the city's homeless.
I've been satisfied that, well, you know, you could always find a way to do more, that if we're going to apply the sensitivity and the responsibility of putting these programs in place for people who in many cases have issues in their life beyond the fact that they are homeless, that it takes time to do this, and that the city and all of its staff and all of the agencies we work with have been moving with the maximum amount of speed to move what is now 1,200 people. These are not moves where you sort of say, well, here, we'll give you a Presto card and you know, you show up at this place and you'll be welcome there. These are complex, sensitive moves. If we did them too fast, we'd be probably facing a potential legal action from somebody who said we were being insensitive to the needs of people who are among our most vulnerable people. And I think it is a remarkable accomplishment, and we're going to try and do as much as we can, as fast as we can. I think it is a remarkable accomplishment that 1,200 people in a matter of a couple of weeks have been moved, with plans to move hundreds more in the next very short period of time. And we will do it as fast as we can. We will speed it up as much as we can, but in some cases it's been external considerations that have not even been to do directly with us that have caused things to be on the timetable they're on. But I am just very admiring of the job that our staff and all of our outside partners have done in providing for things that are unique and at a standard that is tops in North America. And that's exactly where we want to stay in terms of treating some of our most vulnerable people.
And just to Marianne, can you just give us an updated number on how many people within the sheltered system are infected with COVID-19?
We receive the same official numbers as public health, and I think at the moment it is 87 people in 11 locations. Having said that, though, we do know that there is a higher number being reported at Willowdale, and we are just waiting to have that number officially confirmed. But we continue to work with the Willowdale Welcome Centre to make sure we are responding appropriately at that location.
Okay, thank you, Marianne. We go to Mark McAllister now from City News. Mark?
Mayor Tory, if you would, in Vancouver yesterday, there was an announcement that there is going to be a significant number of temporary layoffs with TransLink, and we do know at this point that the TTC is taking on significant losses as well. What are the chances that we're going to see similar layoffs with the TTC, and what can be done to try and prevent that?
What I hope happens, and first and foremost, I will say that I know that we're committed. I've been talking to Mr. Leary throughout, and to you know, the board, and of course our chair, Jay Robinson, who is very much engaged in this even while she's off ill. And our objective will be to make sure that we have a standard of service that allows people in Toronto to move about the city, as we have done, and allows people in the city to move about the city in a healthy manner, as we have done. I'm sure that that we can find a way in discussions with our unions, as we did as a city, to make sure that they can take account of the fact that as things evolve with the crisis, that we're able to evolve how we use our workforce together, with that evolution. And I'm sure those discussions will continue to take place under Mr. Leary's guidance.
Just to follow, so basically you're saying there is a chance that that sort of thing could take place?
It's not my purview to put things on or off the table, except that I have had discussions with the TTC and with its CEO, just to indicate that my major concern is with making sure we provide safe, good service that's healthy for people, and that is a standard that is met. Obviously, we have a very serious financial problem with the TTC, and that the ridership is running at about 600,000 compared to 1.5 million on a daily basis, and that's causing us to lose $20 million a week. So he's looking at various ways in which he can help us with that, knowing that the principal objective we have to follow is to provide good, healthy service to people, to help those who are still traveling on the TTC, especially our healthcare and first responders, to get around the city.
Okay, we'll go to Siobhan Morris from News Talk 1010.
Hi, this question's for both the mayor and Dr. de Villa. Either one of you can take this, or you both can if you want. Are you surprised by the number of questions about when we're going to reopen, as it were, that you've heard since the province announced yesterday that we're maybe peaking on an Ontario scale anyway?
I'm not surprised at this question, because I ask myself the question in the mirror every morning. When is that day coming? And I wish there was an answer that either the Mayor gave back, or for that matter, the Medical Officer of Health, and I say that without the slightest criticism of her. Nobody knows that date. It's going to be based on science. It's going to be based on a lot of trends that Dr. de Villa herself referred to today. The only thing I know for sure, I'm going with her advice, because that's got us to where we are in a positive way in the context of saving a lot of lives and keeping people from getting sick and causing this not to be what it could have been in terms of an even bigger disaster. And that what we can't do is get stampeded in any way into doing something that is not based on the best available advice that we have. Nobody knows that date. I challenge anybody who thinks they know that date to come forward and say how it is that they know when that date will be reached. The only answer we give is as soon as possible, and it'll come sooner if people continue to do what they've been doing to a great extent, which is to follow the rules that have been put out so capably and so professionally by Dr. de Villa and her team.
Yeah, I don't know that I can add much further than to that answer, other than to say that, of course, we understand why that question is being asked and why people would be interested in this. But I would encourage people to look at how far we've come and to continue to stay the course for now, so that we can get to that date, whenever it is, as soon as possible.
Okay, and a question for Mayor Tory. I understand now that the plan to deal with cherry blossoms in Hyde Park involves a full shutdown of the park, as opposed to just blocking parts of it. You've said many times over the last couple of weeks that closing a park like Hyde Park would be impractical to do. So what's changed, and practically then how do you close a park of that size?
Well, I would just say to you the reason it's taken some time to put the plan together, which I think will be outlined to you and to the public as recently as tomorrow, is because it is complex. And it will involve the utilization of a fair number of people to make sure that we can keep people safe. And that's the objective here. Again, the objective is not to be spoil sports or killjoys or people who are trying to ruin those enjoying one of the rites of spring in Toronto. But this spring is different in a lot of respects. And this spring we have to put a plan in place, which will be outlined in due course very shortly, to say to people that we have to do things differently so as to avoid the risk of the virus transmitting itself. And as promised, I can just tell you, whenever the plan comes forward with all of its details on what people can't do, the one thing they will be able to do is to look at this on a video service real time, so that they can enjoy the blossoms that way, just like they're enjoying many other things that way, whether that would be their first choice or not. That will be part of the plan when it comes forward very shortly.
Okay, thank you, Mr. Mayor. Thank you, everybody. That concludes today's media briefing. We will see you tomorrow at 3:45.